angulation means बहुत ज़्यादा vertical angulation दे दिया है. In the same way I've explained you, suppose you are standing on the top of the building, तो जो ground पे object है वो छोटा दिखेगा. So in the same way foreshortening हो जाएगी यहाँ पे. जो IOPR होगा, जो image होगी, object होगा हमारा. Explain the 5 principle of geometry on which these two techniques based. Plus explain bisecting angle technique.
Hi everyone, welcome back to ENAMEL-HEROES. So today we are back with another topic, and that is intraoral radiograph techniques. So in this we are going to study about bisecting angle technique and paralleling angle technique. So let's see what is bisecting angle technique. It accesses the third principle of geometry. And what is the third principle? That is minimum distance between the object and the film. So just look into the figure. So this is the object, that is our teeth, and this is the film, and see they are in contact, means there is a minimum distance between the object and the film. And teeth are always in inclination. See, teeth are always in inclination inside the socket. Okay, so this technique is also called short cone technique. Why? Because it uses a short cone of 6 to 8 inches. All these questions are asked in NEET as well as in Viva separately. Okay, and the bisecting angle technique, it is based on the principle that is Kaizenki's rule of isometry. Okay, and this Kaizenki's rule of isometry follows the theorem of congruency. Now let's see what is the theorem of congruency. So when two triangles share one common side, this, look into the picture. Suppose if we draw a line along the long axis of the tooth, this is the line that we have drawn along the long axis of the tooth, and this is the line, that is a B, we have drawn on the long axis of the X-ray film. And if we divide these two lines, with common side is the bisector. This is the common side. Okay, and two angles are equal. This angle and this angle is equal. Okay, then these two triangles become congruent to each other, and remaining sides become equal in length. So this is the theorem of the congruency. If we draw a line along the long axis of the tooth and along the long axis of the X-ray film, and if we divide these two lines by drawing a bisector, so this is the bisector, this is the bisector, then the two angles are equal and the two sides are equal. When these two angles and two sides are equal, then other two sides, mean this and this, become also equal. So this is a theorem of congruency. Now let's see what are the vertical angulations that we are going to use for bisecting angle technique. So for incisors, for maxilla it is always positive, and for mandible it is always negative. Okay, so for incisors it is plus 40, for canine plus 45, premolars plus 30, for molars plus 20. In the same way for mandible it is minus 15, minus 20, minus 10 and minus 5. Now let's see what is a PID. PID is the position indicating device. As you can see, this is the tube head, and this is the position indicating device, PID. Now see, let's see the position of the PID. So when we are going to take a IOPR for maxilla, then it is always pushed upward. पूछा जाता है सब ये सब एग्जाम में, so just remember. And when we are going to shoot a X-ray for mandible, then it is pointing downward. Okay, now let's see what are the advantages. In bisecting angle technique, the film holder is not used, so patient do not get a problem of gag. Basically, if we use a film holder, then patient complained of gag. Then decrease exposure time. Why there is decrease in exposure time when we are going for bisecting angle technique? Because here we are using short cone of 6 to 8 inches. Just remember the size of the short cone, it is asked in Viva. Okay, so since here we are using short cone, so we can decrease the exposure time. So for shorter period of a time we have to shoot the X-ray. Why? Because the cone is very short. Now let's see the disadvantages. In this, there is the image of zygomatic process of maxilla is frequently superimposed over the apex of the root tips. And here the horizontal and the vertical angulation has to be accessed properly, otherwise there will be cone cut. Now what do I mean by vertical angulation? Here I have explained you the angulation, so it has to be very precise, otherwise there will be a problem of cone cut. कोन कट का क्या मतलब होता है? इट मीन्स when we are taking IOPR, ऊपर से कट सकता है, means the root tips can get trimmed. Now let's see what is the paddling angle technique. So this is also called long cone technique, and in this we are using 16 to 18 inches open cylinder or a cone. So in bisecting angle technique, we studied that access the third principle of geometry, that is the minimum distance between the object and the film, and here it access second, fourth and fifth principle of isometry. Now let's see one by one what are the principles. So first is increase the distance between the focal spot and the object. So we have to increase the distance between the focal spot and the object by using open cylinder. Now position the film parallel to the long axis of the tooth. See, this is the long axis of the tooth and this is the film. So these two are parallel to each other. So this is what the fourth principle says. Now fifth principle is orient the central rays perpendicular to both the object and the film. See, these are the central rays and this is perpendicular to both. This is the object and this is the film, means it is making a 90-degree angle with both the object and the film. So this is what the fifth principle says. Now let's see what are the defects that you basically encounter when you are going for the paralleling angle technique. So first is the vertical angulation defect, means if you give more than required the vertical angulation or the less than required the vertical angulation. So these are the problems that you get. What? The first is the foreshortening. Let me explain you what is foreshortening. More than required vertical angulation. Suppose you are standing at the top of the building and you are asked to see the object which are moving on the road, I mean on the ground floor. Then obviously that object will appear very small to you. Okay? You won't be able to see a larger picture or the exact side picture because you are standing on the top of the building. Having said that, if you give more than required vertical angulation, means बहुत ज़्यादा vertical angulation दे दिया है. In the same way I've explained you, suppose you are standing on the top of the building, तो जो ground पे object है वो छोटा दिखेगा. So in the same way foreshortening हो जाएगी यहाँ पे. जो IOPR होगा, जो image होगी, object होगा हमारा, that is the tooth of the interest. So there will be foreshortening of the tooth. And if we give less than required, means now the person is standing on the road, then he will see the object clearly and obviously it will appear bigger to him as compared to when he was standing on the top of the building. So here if you will give less than required vertical angulation, then there will be elongation, तो वो बड़ा दिखेगा, मतलब there will be elongation of the object. So this is what the defects of paralleling angle technique. Now let's see what are the advantages and the disadvantages. There is no superimposition of the zygomatic process of maxilla over the root apex. Okay. And in disadvantage, film holder is not used, so there is no problem of gag. Second, it is a time consuming method. And last but not the least, since the TFD, what is TFD? Target film distance. Target film and the distance is more. And also I've explained you, they are using the long open-ended cylinder of 16 to 18 inches. So for the X-rays to pass through such a long cylinder, we have to increase the exposure time and KVP. Okay. So that's it for these two techniques. And now, what are the questions that are generally asked from this section? Although this is I'm explaining you for the Viva point of view, it is very important. But see, what are the questions? The first question they can ask you, explain the 5 principle principle of geometry on which these two techniques based, plus explain bisecting angle technique and paralleling angle technique. And also very important, they can ask you the difference or differentiate between bisecting angle technique and paralleling angle technique. Very important. This entire question can come for 10 marks. So it is very important for you to know exact and everything, exact pointers for the viva, and of course the long format type for the long answer type question. So in the next video, maybe in the reel, I'll be giving you, I have handwritten differentiation between these two techniques. So in the next video maybe, or maybe I'll upload a reel for that, for differentiation between bisecting angle technique and the paralleling angle technique. So that's it for this video. Thank you so much and see you soon again.